This individual reached out to ask how I was treating my small fiber neuropathy and peripheral neuropathy, so let's get into it. Also, if we haven't met, my name's Heather. I'm a chronic illness patient and advocate, and I show up on this app to share my story and the resources that have helped me so that it can help you on your journey. This video is going to have a lot of really great information, so make sure to save it in your favorite. So I have peripheral neuropathy and small fiber neuropathy as a comorbid condition to my lupus. I was diagnosed by a neurologist who did a nerve conduction test. So the medication that I am currently using to treat my small fiber neuropathy and peripheral neuropathy is Lyrica. And I'm on a dose of 100 milligrams per day, twice a day. So I take 100 milligrams in the morning and 100 milligrams in the evening. It has helped tremendously for me, but I want to talk about some of the other treatments that can work for other patients. Just for reference, I'm going to be pulling some information today from the Mayo Clinic. So if your neuropathy is mild, your doctor might just prescribe over-the-counter pain medications such as non-steroidal anti-inflammatory drugs like Tylenol, Advil, naproxen, etc. If your symptoms are more severe, a doctor might prescribe painkillers, but because of their addictive nature, they try to avoid this and only use it after all of their therapies have not worked. The next type of medication that they use for neuropathy is anti-seizure medications, and these come in the form of gabapentin and Lyrica. Lyrica is the one that I am on. And even though these medications were developed to treat epilepsy, they have been shown as effective for treating neuropathy as well. The next treatment comes in the form of topical treatment. So this is your creams and your lotions, and there's so many out there on the market that can work for people. There's some that use hot peppers, there's some that use lidocaine, there's some that use cannabis. I don't have one specific one that I use religiously, so I'm interested to hear from our community. If you have a topical treatment that you're using, can you please drop it in the comments to share with our community? The last type of medication on our list are antidepressants. And so there's a certain class of antidepressants called tricyclic antidepressants that comes in the form of amitriptyline, doxepin, and nortriptyline. Sorry, I'm pronouncing those wrong. You can see them here. They help to relieve pain by interfering with the chemical processes in your brain. I'm actually on amitriptyline to help with my bladder condition and my headaches. So it's just another thing that can help me with my neuropathy as well. I'm almost running out of time, but there's a couple of other therapies that have worked for some patients that I want to mention. So the first one is using a TENS machine. Some patients have gone on to IVIG and found relief. Physical therapy can sometimes help. And in worst case scenario, a patient could pursue surgery. As always, I'm trying to reach as many patients as possible, so your engagement is important to me. If you can like and share this post with somebody who might benefit, please do so.